This podcast is brought to you by Infinite Resources, a local staffing agency connecting diverse job candidates in central Iowa companies.
Amplified.
What up out there in the heart of Des Moines, Iowa, better known as the belly of the beast. Here we are, right in the heart of Babylon. This is Dr. Negus Hotep. Thankful for another day and a happy Friday. And today I have a guest, an outstanding guest at that. A young man with power, a young man with vision, a young man with purpose is sitting in the room with me today. His name is Corey Dion Lewis. Say hello, Corey.
Hey, thank you so much. Hello, everybody. Thank you so much for I was gonna say thank you so much for being here. Like, it's my podcast. Thank you for allowing me to be on your podcast.
Oh, well, cool. I know you got your own, and I was just elated when you said yes. I said, oh, this is fun, man. Corey, tell the media, these folks, a little something about you, about what you do, but then tell them something about who you are.
Yeah, so, what I like to say is there's so many different aspects of what I do, but what I am is a health equity advocate. So I advocate in a few ways. Mm-hmm. I advocate through my work at our local safety net hospital here in Des Moines as a clinical health coach. And the people I serve are those that are having issues with diabetes, hypertension. And the reason why that is kind of an equitable experience for them is because it's free. They don't have to, there's no insurance that's involved. They can see a health coach for free there. So they can see me, and I've had some great things to be able to do out of that.
That's wonderful.
The other way I advocate is through my health equity focused company called The Healthy Project. And I do that through my podcast, our health equity event, My City, My Health, and some other things we got in the works, but just to continue that conversation around health equity, and to make sure that it doesn't die down, and that there are things that are going on within our community that go way beyond, eating healthy or exercising. Yes. It's transportation. How are you going to get somewhere? It's occupation. There's so many. There's marginalization. There's racism. There are a lot of things that are keeping my community or the community that I serve from prospering, and those are the conversations that I like to keep going. Yeah. So, who I am, I'm a man of God. I'm a husband. I'm a father. I'm a brother. I'm a friend. I'm a black man trying to do it.
Let me get a fist bump on that, bro. That'll work 8 days a week. But, I know for a topic today, we wanted to talk about blacks' distrust in the U.S. healthcare system. From a historical standpoint, I know in some of my research I did, I looked at the 1934 Tuskegee experiment that occurred and how it went on from 1934 to 1974.
Crazy, right?
Okay, 40 years.
40 years, and they wonder why somebody won't go to the hospital just if they have a sore throat.
You better gargle with some Listerine or something. Get some peroxide and gargle,
But when you think of studies like that, or you think of my own experience with my mother and her story with the healthcare system, and why we had to move her from Illinois to live with me because she almost went blind and almost died from breast cancer because she wasn't getting the proper care. Right?
Yeah. So
when you hear things like that, we got receipts of the treatment of the healthcare system. And yes, I am in the healthcare system myself, but I get it. And I'm just I lived it. You know what I'm saying? So it makes sense, and there's a lot even in 2024, there's a lot we can do to get better at that.
You know, not to be political, but all this political stuff going on. I look back at 2016, and it was old Arkansas governor named Huckabee that was running for president.
Mm-hmm.
And that Seabiscuit had the nerve to say that the Dred Scott decision still stands today.
For what?
Because blacks have no rights. Any whites are bound to respect. That's what Judge Roger B. Taney said back in 1857. And now we see what's going on today in the health care.
What I think, and people are going to have their own opinions.
Yeah.
And what I think is important about today is that the conversation around the mistreatment in healthcare isn't something that's just happening in the barbershop.
Yeah.
It's happening on platforms like this.
Yes.
It's happening from people of color within the healthcare system that aren't like, it used to be bad. No, like, nah, it's bad now.
Mm-hmm.
And what are we going to do about it? Because we're here to serve our community.
Yeah.
We're here to make sure people are getting the best health care that they can. And I think that the more that we continue to talk about the mistrust of it,
yes,
and not let somebody say, oh, well, that's not how it is anymore, try to sweep it under the rug, because that's what happens.
Mm-hmm.
That happens a lot. They would, it's not that bad.
I talked to a brother who happened to be a nurse practitioner that was at Des Moines University several years ago, and he happened to be of African descent, and he told me about a situation where a patient was about to go in that had to be rushed into surgery because the heart was going on and something was about to happen to her, and the woman would die if nobody did anything immediately. And this brother, who happened to be a nurse practitioner, brought this information to the husband of this woman who was in this position. The man said, I need somebody else to talk to because I ain't taking that information, because he looked at who was giving him that information. And he had to tell another doctor who happened to be Caucasian where what was going on. And then when the white guy came back and told the man that, then he understood. And that's on the flip side.
What I think when it comes to healthcare and it comes to mistrust, the biggest thing that we can do is to encourage our black and brown kids to get into the healthcare system.
Yes.
To be the doctors, to be the nurse practitioners, to be the nurses, because as if we don't, we're going to continue to have these problems, because there's always going to be a bias. There's always going to be. It wasn't until recently where they start putting black bodies in these medical books, right? So they don't even know how to treat somebody, and they already have a historical bias on how to treat people of color.
Yeah.
So until we get people that look like us, more people that look like us within the healthcare system, it's going to be an uphill battle when it comes to our people trusting healthcare.
Yeah.
If it wasn't for myself being in the healthcare system and telling my mom, hey, I like this doctor, or hey, I think you should do this, she wasn't going to do nothing.
I hear you. Well, thank God baby boy went to school to learn something about healthcare, didn't he?
Yeah. Or, will I be here being able to talk to my mom in the present tense?
Yes. 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 I can understand that, because it's just asinine in a sense, even how the whole educational healthcare system is created, because it's biased from the beginning. If you look at the oath that every doctor has to make, what they call it, the Hippocratic.
Yeah.
Hippocratic oath. Hippocrates didn't come along 2,000 years after a man named Imhotep, who was the father of medicine. So when we look at even the whole educational system, if the foundation is not right, the building won't stand correctly. So I think we need to get to the truth of the matter and look at how we really, as humans, want to treat human beings. Because when I talked about that 1934 to 1974 issue with the Tuskegee, it's syphilis case. They had to create all the educational institutions and medical institutions around the world had to come together and create something called the Belmont Report.
The Belmont Report, okay.
And it dealt with any time anyone had to do any type of investigation or a study with human specimens, because it's a need to treat people with benevolence. It's a need to treat people with care, because they're in a situation where they need help.
But when you're coming to that person with, you already know what you already think you know about that person, right? You already have, like I said already, a bias around that person. Are you going to approach that person to be able to give them the best care that they deserve?
Yeah. That's something that professionals should be able to come to do. They should have to bracket their own opinions and views. But we know that doesn't happen.
You would think so.
But we know that's not the case. We know that's not the case.
Yeah, no. And look, I know some really good doctors. I know some really good doctors that want to do really, really well. And unfortunately, no matter how well you want to do, unless you're willing to understand, and we're in Iowa, so you're not. It's very rare you're going to find a black provider that you can connect with. So unfortunately, depending on who you are, right? But you're gonna have a provider that doesn't look like you. So you have to really think quickly. You almost have to interview your provider.
Without a doubt.
Like, is this somebody I can trust with my life? You know what I mean? Because not everybody has a son or a daughter that can say, hey, I know X, Y, and Z. You're going to have to figure that out, or have an advocate with you that can make sure you get what you need. But that's a real question. It's a real problem.
Man, you something else. I'm enjoying this. It's just something else. You was telling us something about your health coaching.
Yeah.
Could you enlighten us a little more on your health coaching?
I will. So take it back. I got my degree from the University of Iowa in health coaching. So what I do now, I started in the corporate wellness, and now I'm in the clinical setting. And coaching in a clinical setting is not very common, for the simple fact is that you can't bill for it. You can't bill for health coaching. So, but what I do, so I'm a part of a care team. So you have a doctor, and then your doctor says, hey, you have diabetes, or hey, you want to lose some weight, or hey, your blood pressure, it ain't looking great. I want you to go see Corey. He's our health coach. The benefit of that is, you see your doctor, on average 15, 20 minutes. My sessions are minimum 30 minutes per patient, because I want to make sure we get to understand what is going on with you. So I take a holistic approach to every patient that I see. So I may see somebody for diabetes, hypertension, or weight loss, but when I see them, we start with, okay, when you were younger, what were your eating habits? How did you eat at the table? Because you can learn a lot about somebody's behaviors about how when they grew up, I couldn't leave the table until all my food was gone.
Guaranteed.
So,
we bought that food, boy. You better eat that.
Absolutely.
Come on now.
So you're 10 years old getting this man plate, and you can't leave until that's gone. Now you're a grown, and you cannot leave until your food is gone.
Yeah.
Because how have you been conditioned?
Yeah.
So before I tell you, hey, this is the type of eating plan you should think of, or this is the type of exercise, we gotta figure out what are some of these behaviors that you have learned over decades.
Yeah.
Right.
Yeah.
That we need to focus on, and we will focus on that. There's 3 parts. I call it self. It's better self, and it's sleep, exercise, love, and food. So we talk about sleep. How do you improve? How's your sleep? Are you getting appropriate sleep?
Yeah.
Are you getting healthy sleep? Right. What are you doing for exercise? Exercise isn't always going to the gym. Are you walking every day? Are you stretching? Are you doing what you need to do? Love. What does your self-acceptance look like? Right? Or what does your self-care look like? Right? Do you have a community? Like things like that. And then food. Food is what are you eating?
Yes.
Right? What are you putting in your body?
Yeah.
Now, I'm not telling you gotta go, salads and water all day.
Nah.
But
if you not a vegetarian or vegan, I got you.
But if the problem is diabetes, is the problem is high blood pressure, is the problem is that you have a lot of weight on your knees, then there are things we're gonna have to change with your food. So we will go through all of those. I'm not a dietitian or anything like that. So all of my recommendations are based off of some of the most researched eating plans.
Yeah.
So if I see somebody with high blood pressure, I recommend a certain diet that is recommended for individuals with high blood pressure, and we'll focus on that, or whatever the case may be.
Since you said that, I looked at an article the other day about canola oil, olive oil, and palm oil. And I found out from what some are saying that the palm oil is better for you than canola or olive oil.
So this is what I recommend for the people that I serve. Is now mind you, the community that I serve doesn't have some of them don't have the resources to be able to choose what type of oil
they're gonna use.
That they use.
Yeah.
So I say, hey, use what you got.
Yeah.
Like,
you gonna that chicken is gonna be fried. I don't give a damn what you say. Crisco, here we come.
Right. Use what you have, because we can get lost. We can get lost in the sauce a little bit.
Yeah.
We can get lost in what's the healthier oil? What's the healthier this? What's the healthier that? And it's like, look, what do you have available to you? And then then we will try to make the changes based off of that.
That sounds good. Man, that's excellent. Man, Corey, do you have a question for me?
Well, yeah, I always got a question.
I know, because we like I said, we hadn't had the opportunity to talk too much. And
yeah.
I got you a chance to put me on the spot, if you feel. Just ask me a question.
So given what I just learned about a little bit of your background, I feel, and correct me if I'm wrong, but you have a passion for those that were justice impacted.
Well, I'm inclined to believe that you're correct, because I'm one of them justice impacted people myself. Yeah.
Yeah. So with that being said, what is that next step to really start to think about what are the options for those that are impacted to improve their life? Because what we talked about before we started recording, there is a stigma of I've been impacted, therefore there's nothing I could do, or I'm a step behind.
Yeah, as an individual that's been impacted by the criminal legal system, there are options, but you have to have a made-up mind to attempt to do them. Some people who are impacted come back from corrections with nothing back into communities that they came from with nothing.
Mm.
There's a need for resources, and there's a need for, speaking of my demographic, because I can't speak for anyone else.
Right.
There needs to be organizations that have resources to help individuals because they're locked out of having opportunities to live certain places, to work with at certain places, and to even denied voting rights, because you still, if you're not a voter, you're a voter is a conventional citizen. A non-voter is a carceral citizen. So you're a citizen still connected to prison if you can't vote.
Mm.
So
Oh, I understand that. do you feel like let's talk about systems, right? And we're talking about the mistrust of the healthcare system. But do you feel like, is there a part of you that feels just systems in general, you automatically have a mistrust of the healthcare system? Or do you have a mistrust of the healthcare
I do.
system?
Yeah, I do in a sense because I'm a black man. You know, one of my academic heroes, Derek Bell, he made this comment. He said, "It appears that my worst fears have been realized. We have made progress in everything, yet nothing has changed."
Yeah, we were talking about that earlier. We can, when we're talking about injustice, mistrust in healthcare, insert whatever it is, we can go back decades and it's the same questions, the same problems, the same conversations.
Look at what happened with the SARS COVID-19. It was 1 million plus people died, and I know our demographic disproportionately died at a higher rate. Okay? There's mistrust about people taking those vaccines. There's mistrust about all different kinds of things that sometimes this government says, and some people would say that's ignorant or that's that's not the way America works. But if they're not viewing from the lens that individual is living in,
right? And I think when it comes to that, it's not the message. It's more so who the messenger is.
Yes.
Do you trust the person telling you some of these things?
Yeah.
Especially when it came to COVID. When it came to COVID-19, I will tell you, because I was in the healthcare system, I was one of the first to be able to have the opportunity to get the vaccine. And there is something in your soul as a black person where even if you may have know all the information and all the facts, you're like, when I got that call, you wanted, I was like, give me a minute. Let me think.
Man, you know, because what got me, man, during that time, I had 6 of my fraternity brothers. I'm a member of Omega Psi Phi fraternity, and Eta Eta chapter, New Mexico State University. And we had 6 brothers during that time period from our chapter that died.
Man.
Okay.
Mm-hmm.
And that, that hits home.
It does, especially when somebody you know.
That hits home, man. And I'm like, my God, because I got a shot, or because I don't know if the shot helped me or not. I'm here though. I'm alive.
Yep.
You know, because 1 million people died.
Yeah.
And if the public's, the veil of ignorance should have been lifted from their eyes to see the disparity. And we see right now folks living under bridges. Folks sitting up here at downtown eating at Bubba's and eating the nice, and then here's homeless people walking by the window looking at you. It kind of reminds you of 1929. The Great Depression.
Man, and it's sad to see.
Mm-hmm.
It's sad to see, but then you ask yourself, one, me personally, as a person that sees a problem and wants to see how I can make a change, what do you do? And those people who can, by a snap of a finger, say, hey, this is what we're going to do to change this, and you see them not doing anything.
Because it's not in their heart to do it. It's not their desire to. Those who have the opportunity to make change, if it's not for their benefit, why would I do it?
And that's the world we live in.
Yes, that's absolutely how racial capitalism works in America and throughout the world. Man, Corey, I enjoy talking to you, man.
I appreciate finally to be able to sit with you. Every time I see you, you's on the run somewhere.
Yeah, man. You'll make me come over there and get a cup of coffee at your place one day. No, man. This is something else. You didn't say that what company you worked at too. You with
Broadlawns Medical Center. Broadlawns Medical
Broadlawns.
Center. Yep.
Yeah, man. So that's cool. And this is like I said, a young man. Where you originally from, Cole?
I'm originally from East Moline, Illinois.
East Moline.
East Moline.
East Moline.
Yeah.
Oh man. You make me have a flashback on that. That's all right. Man, it's nice talking to you, man. And
Yes, absolutely.
I appreciate this time that you took out your busy schedule on a Friday to come out and just chop it up with old head.
Yeah, no, you an OG. I had to come and pay my respects.
Oh man, you know what? I still think I'm 17 in my mind, but I know I'm not. Well, man, I appreciate you. You know, everybody out there in the listening audience, I just want to give y'all a final shout out. This is a very intelligent brother who's concerned about the public and just people in general, and he's helping a way to help you preserve and even live a better life.
That part.
And I appreciate you, brother.
Yes, thank you.
Respect.
I appreciate you. I
Man,
appreciate you.
Everybody out there, y'all have a good weekend. Bye now.